Hi, everyone. Thank you so much for joining. We'll give it another minute here to let everyone get in the room. All right, we are at 2 o'clock. Thank you, everybody, for joining us this afternoon for our webinar, Compliance Without Confusion. We're really excited to have everybody here this Friday afternoon. Before we get started, just a couple housekeeping items. This session will run 40 to 45 minutes, and then we'll save some time at the end for Q&A. We'll answer all questions at the end. So as we go through this presentation, if you have any questions that come up, feel free to just send them in the Q&A, and we'll get to them at the end. If for some reason we do run out of time and we go a little long, still send your questions and we'll make sure that we get back to everybody and answer their questions. And then lastly, after this webinar, sometime this afternoon, we'll be sending out the slides and a recording of this webinar, so you can go back and look at it or share it with your team. So with that, I'll kick it over to Kurt Kareska, who is our presenter today.
Good afternoon, everybody. And again, thank you again for joining our webinar. We're excited about the opportunity of really our topic, compliance without confusion. I think there's a lot of information that obviously is continuing to evolve at a state and national level as it's involving compliance and water safety. And so we decided to take a stab at, presenting the information as it's rolling out, hopefully being able to support each of your organizations and your facilities with really just a snapshot of what to look for, how to insulate yourself, risk mitigation, safety for your patients if you're in the healthcare space, and visitors, staff, whomever's in your building. So excited about that. Again, my name is Kurt Kareska. I have worked in and around healthcare for about 35 years, worked with IWC going on a couple of years now. Fascinating industry. My background is also I was a Joint Commission surveyor, and so compliance is near and dear to my heart. So when offered the opportunity, thank you, Rachel, for presenting this, I jumped on immediately. So we'll go ahead and get started. And as Rachel said, my goal is to leave time at the end for Q&A. If we do run out of time, we will absolutely respond to each one of your questions and any follow-up you may need. So we'll go ahead and get started. What is Legionella? I think before I jump into this slide, I think it's pretty important that we understand kind of the history of water. Okay, so for years, water has been overseen and mandated by the EPA, by the CDC for safety, and that began way back. In 1974 was the first opportunity for the government to pass the Safe Water Drinking Act. And what's interesting is that there hasn't been much change since then, but that act resulted out of a continual really colonization and infection of individuals as just from consumption of water. So the government jumped in, partnered with the EPA to create the Safe Water Drinking Act, which really is an act that identifies how municipalities, how government should be able to manage water for the safety of the people in their community. And then obviously, that's stemming into everything that we're going to talk about today. So, but what is Legionella? And it's the primary focus is all of us have witnessed and watched what's happening in the press. The latest result of obviously the tragic events in Harlem, New York, with the passing of 7 people, the over 140 people hospitalized as a result of Legionnaire's disease. Legionella is, again, it's a bacteria that's naturally occurring in water. I mean, it is in your water systems. It's migrating through your buildings. There's about 60 different species of Legionella. What we primarily see in our case investigations and our unfortunate outcomes is Legionella pneumophila, which is essentially pneumonia. It's pneumonia from the contraction of water particles that's been, inhaled during whatever the situation is. And you see on the bottom of this slide the opportunities, whether it's cooling towers. And if you think about it, if you're in a hotel room and you are washing your face and the sink is running, that's creating particles. If you're taking shower, if you're walking through a a open venue with a water fountain or water indoor water feature, all of those things are risks because of the particles that are migrating through the air as we're just breathing in and out. And so essentially, as we are consuming the water, if the water is not affected, meaning that there has not been a colonization or it has not migrated into a Legionnaire's disease, then you're perfectly fine. It just happens. But what will happen many times is that under the right temperatures, under the right situations, if not properly treated and maintained, you run the risk of a colonization and a potential infection outbreak where individuals walking through buildings, again, whatever situation, patients, when this comes into consumption. Now, most people who contract Legionnaire's disease, they generally have a body that the immune system can fight it off. There's a very vulnerable population that it becomes susceptible to really bad outcomes, which we'll cover that in a bit. But Legionella multiplies in various opportunities. Temperature being one of the most prevalent is once the temperature in your water system reaches an optimal level, 95 degrees to say 115, the probability of colonization, the probability of formation of Legionnaire's disease goes way up. And so we'll talk a little bit more, obviously, as we progress through about keeping your cold water cold and keeping your hot water hot. But all of these things, again, kind of lead to our potential outcomes, negative outcomes, if we're not kind of finger on the pulse of what we're supposed to be doing. But again, Legionella is the bug that lives in the system. It lives in every water system. We can't get rid of it. We partner with municipalities. All of our buildings do in cities to where they're utilizing chlorine generally or disinfectant to go through the system to try to keep it safe. But even in those situations, based on the right opportunity, you can do a lot of things, or the city can do a lot of things right. But based on the right opportunity in buildings, you could still have an outbreak. So, how does Legionella live in your building? So I'm going to talk a little bit about kind of what happens when water comes into the building. Okay. So every municipality in the country is mandated on a disinfection into the system, every public water system. And so what will end up happening is as they are interjecting their disinfection or sanitization chemical that's running through their city, what will happen is they'll enter into a building. Okay. Based on the age of the building, based on the quality of piping in the building, the building may have a 4-inch water line, which actually may only be 2 inches because of what's considered biofilm. So now biofilm is really just this slimy kind of, I guess, accumulation of everything from minerals in the system to if you have bad piping that's breaking apart to prior disinfection and kind of those bacteria that have been killed and are sitting, well, they end up forming this film that obviously continues to build and build as water continues to rush. Now, what's interesting is that as water is moving through it, and as we'll use chlorine, as chlorine is going through, anything that is suspended in the water and the free flowing water, the bacteria, the chlorine will definitely affect. But where Legionella is pretty crafty is it hides inside of your biofilm. And so again, it's fine sitting there as long as the temperature doesn't exceed those parameter levels, or as long as it's not stagnation, it's fine. It just kind of lives. But once you start creating those risk opportunities, then you're increasing the probability of the risk of colonization, which then it comes into your water system and it migrates through your building. And so biofilm is really what should be talked about more than not, about how do we eliminate or how we move the biofilm through our system to make our pipes safe again. Because again, if you think of it like almost like scaffolding a building. Okay, as that scaffolding goes up and up and up, right? The opportunity to take it down at the bottom doesn't work because then it all falls. So you have to kind of start cutting from here to get to the bottom. The chlorine that's running in your system all the time won't do that. It will definitely kill what's in the free chlorine will definitely kill what's in the water that is suspended above that biofilm. So, part of the opportunity we have around water management plans and keeping your water safe, keeping your water clean, is removing or eliminating or at least reducing that biofilm probability, which then will greatly reduce the probability of Legionnaire's disease or colonization of Legionella. Yeah, before you go, Rachel. So these pipes give, or this slide gives a couple of indications. Oh, jumped too far ahead. Sorry, my fault. There we go. There you go. It's all right. This gives a couple of kind of slides, if you will, of what I was just talking about. The slide to your left is kind of really the accumulation, which is not some of the worst we've seen, to be honest with you, but it's the accumulation of that biofilm, which really explains what I was just talking about on the slide to the right, on a cross section of piping. So you can see where the accumulation and where kind of the secreted slime and where the bacteria begins to hide versus what's already suspended in the system, which is what's naturally occurring in water already. And so as that chlorinated water is moving through, everything that's suspended is vulnerable. Everything that's hiding down in the Legionella is where you run your greatest risk as well. Okay, sorry, Rachel. So you're going to hear this repeatedly from me over and over and over again. It's not a matter of if, it's a matter of when. So part of my background is in healthcare is I was a hospital administrator. I oversaw hospitals, residential care facilities, at pretty much every level of care. And so I always lived in the world of we're never going to get away from it not happening to us. And because I used to hear it all the time, well, it's never happened. Well, it's not about has it never happened, it's when is it going to happen and what are we going to do to reduce our risk. So part of all of our responsibilities is safety. That is the number one responsibility of people that are inhabiting our buildings or in our workspaces. We want to make sure that that environment is safe for our employees, for our patients, for whomever it is, visitors who come in. And so here is some statistical kind of pieces that we pulled together. But if we live in a world where it's not going to happen to me, okay, I will just tell you beyond a shadow of a doubt, you're a fool waiting for it to happen because it absolutely will happen. Risk mitigation is about preparing for the problem before the problem shows up. And again, I'll say that 1,000 times, probably not 1,000, but I'll say that a lot during the course of this webinar, is that our opportunity as people on this call and our opportunity as leaders is to ensure that we're taking every proactive measure we can to prevent the probability and the possibility, but probability of what's going to happen with eventual outbreak or untold events. So you'll see on here where the escalation, we have a few slides here, but the escalation of reported Legionnaire's disease has escalated on a year over year 4 times per year. So 300 some odd percent, this thing has gone up over since the beginning of the decade. 74% of the people admitted are over the age of 50, admitted to hospitalization are over the age of 50 because we become vulnerable. So that's my age group. So we become vulnerable because our systems, over time, our systems aren't as strong. Our immune systems, our ability to fight off disease isn't as strong. And so we become the vulnerable population. 20% of the cases are coming from long-term care. 20% of the cases being admitted to hospitals today are coming out of assisted livings and nursing homes. 1 out of 10 who admit from community pass away. They can't fight it and they end up losing their life. 25% who are coming out of nursing homes, coming out of assisted livings, pass away in the hospital as a direct result of exposure to the disease. What's most important in this is 9 out of 10 cases prevented. 9 out of 10 cases. Why is it not 10 out of 10? Because we're not perfect. There's, and you'll see in the slides coming, there's no way to have a foolproof, there's no way it's ever going to happen to me. So there's always that. But 90% of the time that we have, that of the cases that were presented were preventable. All right. So we're going to talk a little bit about operating standards, okay? CMS, which stands for the Center for Medicare and Medicaid Services, okay, which is essentially the watchdog of the government's money as it's applicable to healthcare. So if your organization takes an assignment of benefits from Medicare or from Medicaid, you are subject to CMS standards. Okay. So listed on here are all of those who fall under that umbrella, which includes obviously healthcare, hospitals and clinics. You've got long-term care facilities, hospice and home agencies, home healthcare agencies, which most people don't realize falls under the auspices of CMS. Specialty providers, rehabilitation facilities, which rehabilitation facilities are facilities that have now included a wide compass. You have physical rehabilitation, sometimes you have emotional and substance dependence rehabilitation. These are all falling under a new umbrella. Specialty providers, individual practitioners. Again, if you're taking an assignment of benefits, you're subject to CMS. And obviously telemedicine providers, which again, different new as we've come through COVID. Telemedicine has become a very popular invention, but they are too subject to CMS standards. Okay, Joe. So CMS, again, as I shared, CMS is the watchdog of the government's money. And so if you ever have a black Suburban pull up to the front of your facility and you have a bunch of people getting out with the black windbreakers with the three CMS letters on their back, the day is not going to be good. I will tell you. CMS does not show up in facilities to make your facility run better or coach you or help you. They come in as a result of a bad event. Either it's a death or there's a complaint or something's going on. So CMS pushed into water safety years ago. This you'll see on here the memorandum. I'm not going to read all throughout it, but the first memorandum was mandating water management programs for the control of Legionella as a result of what they were seeing in escalated outcomes. You'll see 42 CFR 48380 mandates specifically to skilled nursing facilities and nursing homes, essentially. And the facility must establish and maintain an infection prevention and control program designed to provide a safe, sanitary, and comfortable environment to help prevent the development and transmission of communicable diseases and infections. Okay. The reason I titled this Pulling Strings. So if you're old like me, you probably had in your life as you were wearing a sweater. And I vividly remember walking into my grandmother's house and I had a string coming off my sweater. And my grandmother said, "Don't you dare pull that." And I said, "Why?" As I started to pull it, because that's what I do. And then I realized that one small string then started stretching and started pulling my sweater apart. So when CMS arrives in your facility, please understand that if they're there to really take a deep dive into your water management plan or your prevention plan as a result of an event or an issue, they're not going to stop there. They're going to continue to pull. They're going to continue to request additional information around environment of care, around life safety, around patient care, around patient rights, and eventually that will get up to leadership. Okay. So if your findings at the beginning of this are that you are not prepared, that you don't have the right documentation, or you don't have the right support, I can assure you it won't be one finding and they leave. Okay. They will be sitting and then they will dig all through your organization, trying to find where else have we not ensured the safety of our clientele, ensured the safety of our visitors and of our staff. So, again, next one. So before I go too far, I should have warned you on the beginning of this, right? There's not a lot of warm fuzzy in this, only because I mean this is compliance, right? This is again my focus point for this webinar, and what I do within IBC is risk mitigation, is to ensure that we have everything in place, that we support people in the industry who are our clients to reduce their risk, to prevent what could possibly happen again through survey, through lawsuit, whatnot. But again, going on. So OSHA jumped in a long time ago, which is really applicable to water management plans and water safety, where they mandated that it is the employer's responsibility to create an environment, a workspace, that we recognize the risk and that we take mitigating steps to reduce those risks to ensure that there is no harm to our employees or people who are in our buildings, essentially. Next one. Then there's the Joint Commission, right? So you have CMS. So just to explain, so CMS is the watchdog of the government's money. Okay. The Joint Commission is essentially an accrediting body that sets standards in place for if you're taking an assignment of benefits from commercial insurance. Okay. They have established their standards, which ironically mirror CMS. And in many states, such as Ohio, Joint Commission acts as CMS. It's what's called deemed status. You have a lot of states like this where the Joint Commission serves walk in, whether you're taking assignment of benefits from a commercial insurance or not. They represent CMS in the state, and they will walk in and do a CMS survey. But Joint Commission essentially is, again, their primary focus is safety and patient care. That is what they're in your buildings to do if you're Joint Commission accredited. And your accreditations are on 3-year triennials, and they will, meaning every 3 years they come survey you again. The surveys could be anywhere from 3 days to 5 days. It will involve engineers, it will involve clinical people, it will involve nurses and psychiatrists, depending on your services. And so what the Joint Commission comes in to do, much like CMS, is they will under the engineer will move to your life safety and will start asking for, show me evidence of. Okay, show me evidence of your compliance with your water management or water safety, which will include water management plans. For years, organizations in healthcare spaces have used the CDC toolkit to create water management plans and kind of just presented that. As a result of, again, the last probably decade, we have seen an increase in very viable questions as to not just are you reporting what's coming in from the city, but are you testing? Or can you show me evidence of safety and compliance as it's outlined in protecting? Again, much the same as CMS, it's like pulling strings. If they show up and they find that you're in violation of the standards or the state's rule, they will then start going down the rabbit hole. And what I've listed on here, IC stands for infection control. EC stands for environment of care. I actually ran out of space because much like CMS, they're going to start going down the path of if we find evidence of an environmental control violation where you do not have a water management plan or you did not have a team that created the plan or you're not following up on your plan annually, then we're going to take that step and then we're going to start moving down the line. With CMS, much like Joint Commission, is they will have a standard and then they have what's called an EP or element of performance, which may be two or three different opportunities. Okay. So an element of performance will indicate, again, as I shared, do you have a plan? What is the reporting in your plan? What was the team? Each one of those are elements, which each one of those can be findings. So eventually they will take that step and then they will move out of environment of care. Because if you failed there, then you've created an infection control issue, or you've created a risk issue, or you've created, and eventually it'll get to patient care. And then eventually it'll come to leadership, where leadership failed. And you'll see that's the first one, LDO 101. The governing body is ultimately accountable for the safety and quality of care and treatment of services. Okay. From these groups, what will end up happening is based on the severity, based on the findings, the risk is you could lose your Medicare certification, which would effectively, depending on your revenue flow, could put you out of business. They can suspend and put you in what's called immediate jeopardy, which means you get a time to fix it. And if the findings aren't that bad, they will ask for corrective action. The goal of CMS and the goal of Joint Commission is not to put you out of business. That is not the goal. We are in need in our communities. There's no doubt about that. But the primary oversight goal is to ensure that you're maintaining the standards set forth, okay, and that you're ensuring the safety of your, again, your clients, your employees, and any visitor that comes in the building. And so, again, your licensing and accrediting bodies, okay, we'll talk about the state licensing in a second, but your licensing and accrediting bodies are what are driving safety to everyone who walks through your building to increase the probable good outcomes of your client's care or your employees' participation in your workplace. Okay, we'll go to the next one. The health department or Department of Health. So all states have adopted water management plan mandates, all states. Okay. And so part of the opportunity and when an event occurs, meaning a sentinel event or somebody passes away, and you have to report that to the state, what will generally occur is that the state will notify the facility and they will launch an investigation as to are you maintaining an environment of safety? Are you maintaining an opportunity of corrective action and improvement? Is there reporting? So they will come in and they'll do a case investigation on the facility. Okay. As part of your licensing process, part of the mandates to get licensed is that you have water management plans, you have safety plans. Okay. So as we're kind of walking through these slides, I mean, the opportunity, you're going to hear this a lot. The opportunity is risk mitigation is about water management plan, about follow-up testing and ensuring safety. But the Department of Health will come in and again, their goal is to work with you. Their goal is to not shut you down. The goal is to keep you open, but the same goal you have to understand within the community because what'll end up happening is that unfortunate event will hit the press. And then when it hits the press, all the people in the community will go right to the state, said, whose license is this place, right? And so the state is going to do what they need to do to make sure that you're following your state standards. They're not the bad guys here, I promise you. They are there to support and help, and they will put forth kind of a step-by-step plan of how you're going to mitigate this, how you're going to present a improved program if you don't have a program, but an improved program to keep you kind of moving forward and taking care of your patients. But remember, their primary focus is not just the event, it's also the rest of the people in the building, right? The rest of your patients are in the building, the rest of the employees in your building. So each state will kind of put forth their very specific protocols. We'll get into the state regulations here in a second, but each one has their own protocols. But at a general umbrella, all of the states have mandated water management plans. So these next few slides, So these are reported cases per 100,000 in a population. So you're going to see the evolution of Legionella reported cases. And again, reported cases are cases that arrive in healthcare facilities, meaning that hospitals, meaning they've escalated out of either nursing homes or within their community. The other is reported cases to the state health department, which happens as a result of, testing or whatever it happens to be. So you look at 2000. This is a really, really important series of slides, but look at 2007. Okay, we'll progress forward. 2012, start seeing a trend here. 2017, and then 2018. Okay, obviously the graph to the right shows your kind of parameters to your color coding of the states. So the million-dollar question is, what's causing all of this increase? I mean, water has been water, right? Some of it is the attention that's been given to kind of the reportable cases. Some of it is the infrastructure within health departments to report up and monitor. Another piece of that is what's going on with municipalities and the disinfection that's going into the system. So it's a myriad of things, but over it all, I mean, we could talk about global warming all day long, but overall, okay, the issue is this has become an awareness issue that has escalated up to the CDC, that has escalated up to your state licensing, that obviously has escalated up to the CDC and CMS. Okay, so this was the last map picture that we have. I can only imagine, as a result of what we've seen in the last 5 years, the escalation of reported cases that we're seeing in the press, that this is going to be a very different colored map the next time the CDC releases this. So I wanted everybody to kind of get their head and their hands around really kind of what we're looking at in the severity of our opportunities here to have events that obviously, and again, it's not a matter of if, it's a matter of when. This escalation proves that right there. Okay, next one. All right. So current legislation. Obviously, when you looked at the prior slide, you saw the coloring of the slides. Not a shock that you have states that have very specific legislation. Now, again, as I say, the Department of Health has always mandated water management plans. That's not the issue. What the issue is that those are standards for licensing and standards for maintaining compliance. When the state steps in and actually enacts laws, it essentially takes that standard and puts more teeth into it and more requirements. For instance, I'm going to give you a few of these. I'm going to cover all of these, but the ones in green are the ones that already have current legislation. New York, we'll just start there. New York has mandated cooling towers, hospitals, residential care facilities, sampling, testing, and reporting. Okay. And what they generally do, that law never specified at the time kind of frequency of testing. It's just that you have to test. And then if you have a positives that above a certain threshold that's set by the lab, if you have positives, then you have to come forth with kind of a corrective action plan, which again, go back to CMS is mandated there. What's interesting, as a result of what we all saw in the press in Harlem, as a result of the deaths and the hospitalizations, the state has now moved into monthly testing, and during warm months are mandating chemical treatment to all cooling towers. Now, that's a result or a reaction of what happened in the press. What happened? Because again, there was a history where very little of it ever hit the press, right? Well, now it's hitting the press. Now states are following. Ohio just recently passed their law that went into effect last year, which essentially mandated that healthcare facilities, residential care facilities, have to perform rounds of testing, and you have to have 2 rounds of testing per year. Okay, with non-detection. If there's detection, have to be reported, and you have to move into corrective actions. So, and they actually even took it another step and moved into kind of timeframes that are allowable, meaning that you have to do it within 4 months of the year, and you can't exceed 8 months in that calendar year. So, meaning that you can't jam up 2 rounds of testing in the first quarter. You've got to actually spread it out, but these are your parameters. Okay. Residential care facilities, which let me pause right quick. Residential care facilities are really defined as anybody that's sleeping overnight in a bed that is not their own, meaning that they don't own that bed, their home, whatever it happens to be. So again, we talk about nursing homes, talk about assisted living programs, you talk about residential addiction treatment centers, mental health hospitals, mental health addiction or mental health residential programs, anything that sleeps at group homes. You've got boarding schools that sleep those kids over. All of this is mandated. Another state that kind of jumps off the page is Virginia. So Virginia is a state that mandated that all public schools are required water management plan and testing. So you can start to see, and again, not to go through all of them, but you can start to see the momentum of what's happening. And the last state I'll probably touch on, which is New Jersey. New Jersey recently passed. New Jersey, by the way, if anybody's on the call from New Jersey, your state loves to be first in everything. I just tell you that. Any kind of law, you guys love to be first at it. I think it's a thing with New York. You like to be ahead of New York. But regardless, New Jersey passed a law that went into effect this year that essentially mandates that residential care facilities and all public access buildings, think about that, all public access buildings are susceptible water management plans and testing. That includes not just healthcare, correctional facilities. It includes any building you walk into, which is hotels, which they're mandating that everybody has to participate in water management plans and water safety programs. So, I mean, again, all of this is a result of what's happening, what those events are being reported, and the escalation of what we're seeing with Legionnaire's disease. Okay, Rachel. Well, before you go, Rachel, hold on a second. Before you go, you'll see the states that have currently proposed laws that are on the books right now. What that means is essentially they have a a political person, a congressman, a legislator in their state who is authoring a law specifically that takes water management plans to a new level. For a long time, again, we determined that they were just following kind of the map of Legionnaire's disease, reported Legionnaire's disease going up, but they're not. When you start seeing the migration, these are states that are taking very proactive measures to ensure that their buildings are safe and that the inhabitants of the buildings, the patients, staff, everything I already said remains safe. So now, many times California had a law probably 2 years ago. They got killed in committee, but it's back on the books now. So go ahead, Rachel. All right. Here's the deal. So, what surveyors are looking for? The first thing we look for when we walk in a building, do you have a policy in place and are you following your policy? That's the very first thing we look for. Are facilities based on that policy? Do you have a water management plan? Are you reporting those interventions to your safety meetings, your safety committee, or whatever it happens to be? Part of the requirement of creating water management plans, or part of the directive from the CDC and the toolkit, is that in ASHRAE 188 is that you're creating water management plans, really hopefully utilizing teams. I've included in here some of what I believe is probably the most important people, because you don't want this thing done in a vacuum. You want there to be a full range of opportunity of people who can opine into any kind of outcomes. For instance, plan operations officer, chief nursing officer, infection control, life safety officers. You can literally take your safety team, your safety committee team, and put them on this water management plan development. The next step you take is that you map the entire facility. You look at all your water lines, you look at all of the opportunities, you look for dead legs, you look for everything that is susceptible. Is that if there is evidence that the facility has, as a result of that, you're creating a water management plan, which we'll go into in a second. But as a result of that, and through your findings, if there's evidence, surveyors are going to ask, what are you doing about that? What has been done? What's the corrective action? What are your next steps to ensure that you maintain compliance? And does the facility on an annual basis review that water management plan? That's the information we look for when we walk in the building. Do you have a policy? Did you follow the rules? Are you reporting to your safety committee? Are you acting appropriately? And are you annually looking at the outcomes, reviewing that water management plan and updating it, or actually signing off that we're going to move forward? Okay. All right. So clearly, what is the underlying theme of this? Water management plans, right? So number one line of defense is have a plan in place. It's the nature of any risk mitigation is what's the plan and are you operating by the plan? It's one thing to have a plan, and I want to say this. It's one thing to have a plan. It's a whole nother thing to actually be living in the plan and letting the plan work for you and you work for it. So we'll take a deep dive into water management plans right quick. So obviously, water management plan is a document that outlines a building's water system with the idea of controlling the risk of Legionella bacteria or other waterborne pathogens. You'll see the cycle here. I've listed it on this slide, that it's a continual revolving cycle, right? Mapping your water system, applying your control measures, which really means you're looking at what are the points that we're testing? What is the chemical coming into the building? Are we testing our water? Are we documenting? And then you're constantly following that circle to ensure, right, that you're maintaining your compliance and ensuring that the water management plan, again, is working for you. This is not a one and done, check the box. So, and I will say to you this, that why this is critically important. As a surveyor, when I would walk into a building and I would ask for a policy or I'd ask for evidence of outcome, okay, When the people would get up and leave the room and then come back in about 15 minutes, I know what they were doing. They're over there pencil whipping something, or they're creating something real quick, or whatever it happens to be. Surveyors know that. It immediately raises the concern of, is this building really safe? Which takes a deeper dive into a whole nother series of questions. Again, I'm pulling strings here, right? So please buy into this process. Please buy into the necessity of water management plans and the outcomes and reporting and intervening when you have an outcome that is outside of your limits or your parameters. Next slide. Here's your program components. Why the water management plan? So, infection control, number one. Infection prevention is number one. You want to avoid any sentinel event outcome or any health related outcome that's a direct result of not having a plan or not acting or not keeping the water safe. Then it falls into regulatory compliance. Obviously, we've talked enough about the regulatory groups that are overseeing this. Corporate development. What we're really talking about here is as companies begin to invest in growing opportunities, growing just revenue lines or growing additional businesses, they're going to look on the inside as to, do we have our proverbial ducks in a row? Are we ready to take a right next step, which then falls into the strategy of growth, planning and preparation, everything goes in. So water management plans play a very significant piece in this story. Construction and renovation. So as we're putting together the program components of a water management plan, we take a look at a lot of things. Okay. We're taking a look at when the building was created, was built. Okay. We're taking a look at any construction going on in the area. We're taking a look at kind of the life cycle of the building, meaning what is the age of the plumbing, what is all of these things are program components that go into the development of your plan. But you'll see as this wheel is moving forward, the program itself, as it's moving forward, all of the pieces that it touches along the way. Again, around strategy and development, I've touched on that a little bit, but around strategy and development, when we know that we have a team and we know that we are in a position of safety, security, and that our documents can stand on its own, we're in good water. We press forward. Okay, go to the next one. I'm trying to be mindful of my time here. All right. So here's the real truth. All right. I love talking about the truth. So the truth is, even under the best conditions possible, right, in which a system is routinely cleaned and treated, Legionella still exists in your system. It still proliferates in your system. Why? Because it exists in the water. It's a naturally occurring bacteria in water. Okay. So obviously, we have to understand it cannot be completely eliminated, but we can do a lot on the inside of the building to make it safe. There is no standard directive or protocol to remove Legionella. It's not, okay? What we do have, though, is we have measures that we have proven over time with flushing, with filtering, sometimes remediations. We can improve the probability of not having a bad event, okay? The next point to this is very important. Company owners do not get to delegate duty or authority away, meaning that we can't point the finger. As a building owner, I can't point the finger at the city and say, well, they don't put enough disinfection or chlorine in the system. It's not my fault. Can't do that. Why? Because I'm responsible for everything from when that water enters my building, that point of entering the building. I am responsible for everything in that building. The building owner is. The appropriate legal standard or duty is reasonable care. And I will say this 1,000 times as I'm talking to CEOs or executive directors or building owners, is that it is your responsibility. You're not the victim here, right? You are responsible. You are accountable. So you have to do everything you can do to make this building safe. If it's not water, it's fire safety. That's the responsibility of the building and of the owners. That's the real truth. Next one. What should I do? What should I do? So the buildings I've walked into in the past, most of them have hazard vulnerability analysis. They've done it. They've looked at what are the possible events that would disrupt the services. And it's usually things like weather or cyber attack or something like that. And then in there, they will rank, and I'm sure you guys did this, but we will rate the probability as low, medium, or high, and then we'll have a corrective action in case those things occur. If there's an ice storm, people can't get to work, what do we do? Right? If the electricity goes out, what do we do? That's hazard vulnerability. Okay. What you really need to do is the first line on here, which is a proactive risk assessment. You need to determine. So the difference is what happens outside the building that affects the day-to-day. Proactive risk assessment is what happens inside the building, right? That would affect my clientele or my staff. What do I have to do? Identifying water as a potential proactive as a potential risk. You put forth a proactive risk assessment. You identify your water management plans. You identify your testing. You identify all the things that you're doing, whether it's flushing or filtering or whatever you're doing. So if an event occurs and somebody like me, a surveyor, shows up, and I look at that, I said, "Can you show me your documentation?" You're going to bring me your water management plan results, and you're going to bring me your proactive and hazard vulnerability assessment. That's what you're going to do, right? If I see it identified and I see what you've done, okay, because again, we can't completely eradicate Legionella. We know that, right? If I see that the facility has taken all these steps to ensure the safety, the probability of any kind of finding, their probability of any kind of fine goes way down at that point. But again, it's preparation and planning and not sticking our head in the sand, believing it's not going to happen to me, because it's not a matter of if, it's a matter of when. Okay. The other couple points on here are water system upkeep. It's very, very critically important that you understand one of the opportunities for Legionella to colonize and become Legionnaire's disease is dead legs in your system. Okay. Is plumbing changes would create dead legs. Dead legs are just water that's sitting there. And again, remember, temperature, stagnation, these are optimal opportunities for the colonization for bacteria to grow to become something infectious. Okay. So maintaining your water system upkeep, if you have piping that is outdated, if you're struggling with positive testing from that's detecting Legionella in your system, and you've got a building that's 80 years old, that's kind of old piping, old composite piping, that piping is just deteriorating, and all of those minerals that are in there become food essentially for bacteria. You're going to need to take an honest look at what do around your plumbing. For one, for sure, is you need to start removing dead legs. Cut them out. Make sure that water is flowing. Keep the water hot and the water cold, but also keep the water moving. You don't want dead legs. If in fact you have unoccupied spaces, you want to make sure you have a flushing program. Okay, you want to make sure that, and I don't care who it is, it's your housekeeping staff, it's you, I don't care who it is, that you're walking into those rooms, you're turning on those faucets, and you're letting them run. Moving water prevents the colonization. Moving water will do that. Testing is another critical piece to this. What should you do? Don't be afraid of the truth, is what I would say to people, right? It's one of those things like I don't want to go to the doctor because I'm afraid he's going to tell me I have the flu. Right. So just be there and be sick then, right? No, don't be afraid of the truth, right? Test, because if you identify it, then you can stop and prevent the eventual bad outcome that could happen down line versus sticking your head in the sand and believe it ain't going to happen to you. Okay. So my point of this slide is do something. Okay. Do something. Make sure at the very minimum you have the top three of these taken care of. Okay. Make sure. Critical, critical. Secondary, but I believe equally as important, is making sure you're keeping your water system updated and making sure you're testing, making sure that you're not caught by surprise. Every every facility leader, manager, owner, whatever it happens to be, the worst scenario in the world is for somebody to come in and test your water outside of you and say, "This is what we found. Did you know that?" And your response is, "I had no idea." Bad, bad day. So be in the know. Okay, next slide. The cost, unexpected and expected costs. So I touched on this a few minutes ago, okay, where what generates policy change in states? Well, many times it is outcome events that they identify through the Department of Health or whomever it has to be. More times than not, it's press. It's reporting that hits the press that then everybody in the community goes to their elected officials and say, "What are you doing? What are you doing here?" That's what generates laws within communities to pass. I guarantee it happens every single time, right? So you're looking at those costs as a result. We're going to look at those costs as a result of the events and what happens with state legislation. The first is the medical cost. Obviously, if your staff are infected, okay, and then have to go out, your responsibility, obviously, because it's a workman's comp issue, is the cost to the company, the organization. The next is the legal cost. We're seeing it all for probably the last 20 years. There's actually law firms that do only Legionella or Legionnaire's disease lawsuits. That is their sole focus, and they're really, really good at it. And ironically, where do they start? Do you have a water management plan? Were you following your plan, right? Don't equip people with a lawsuit against you. But the legal costs are kind of continuing to escalate everywhere from, the smallest case that I had investigated was $850, $900,000 to the last, which was $10 million. Now we haven't seen the outcome of the current lawsuits that are already going through the system as a result of the Harlem outbreak, but they're coming. The other piece of that is that this isn't just patients suing. Okay, remember when a patient dies in your facility or a patient gets sick and contracts Legionnaire's disease in your facilities, there's three different levels of people who can sue that facility. There's a patient if they survive. Okay, if they don't, there's a family member, and then there's an estate. They can all file lawsuits against you. The other side of it is that if an employee contracts, they can also file suit, which we're starting to see more and more of that. We saw that in the New York case. So legal costs are mounting. And one of the things that's extremely difficult for facilities to bounce back from, especially smaller nursing homes or assisted livings, is those kinds of lawsuits. Okay. So reputation damage is my next one. Again, you live in the world of public opinion, right? People will judge by what they know, what they read on the internet, what they see on Twitter, what they will begin to judge. Okay. Your reputation, you could be an amazing facility and have a bad event. No, and depending on how it's written up or depending on the hysteria of what's going on, you take a reputation slam, which will then migrate eventually to the mothership or the corporate office. Okay. So recovering from that reputation takes time, which means your census drops, which means you have more state visits, which means all of these things begin to happen. The other piece of the story, which should be some of the expected costs, which is if you have an outbreak of Legionella in your system, Legionnaire's disease in your system, the state gets involved and does a case investigation. There is a high probability that they're going to request a remediation. And remediation is essentially a company like IWC will come into your organization or your building, and we will push our chemicals through your system, through your entire water system, and eliminate or remove the Legionella, the biofilm, and I like to say all the bugs in the system. Our goal is to push it all out so that we get to start from square one. You have a clean water system. Okay. Now remember, we can only do what we can do. If you got dead legs, if you got spaces that are unoccupied, I mean, we can only kind of, as long as the water's moving, we can get to it, right? So I go back to why managing your water plan is critically important, or your water system. But cleaning costs range anywhere, again, depending on the size of your facility, could be, and depending on your vendor, could be $10,000, could be $100,000. But again, these are costs that happen as a result of the outbreak that occurs. Fines are the next one. Not uncommon for the Department of Health to come in behind and issue fines, especially if there's been a historical issue with outbreaks and the corrective actions have not been appropriate. The state will fine you. Not every state does it, but most states will do that. The other side of it is that CMS definitely has the permission to levy fines on facilities when they have not complied with the CMS mandates or standards. Okay, so those all come down. And then the last, and this is a new development, the last is your professional liability, general liability coverage. As somebody who grew up on the coast, I grew up in down on the Gulf Coast near Padre Island. When I grew up, we could always get flood insurance at our homes, right? My mom tells this story all the time. After a series of hurricanes in the 80s, we could no longer get flood insurance, right? And if you did, it was an escalating cost. Why? Because of all the money that the insurance companies had to pay out to repair your houses as a result of the hurricanes. Got it. We're starting to see that with providers now requesting either a separate rider, okay, to specifically cover Legionella and Legionnaire's disease outbreaks, or we're seeing the cost in healthcare buildings of going up for that general liability and professional liability coverage. Why are they doing it? Because of lawsuits. That's what's happening, because of lawsuits. Okay, next slide. So per the CDC, okay, the best method for validation of water management plans for Legionella is routine testing over time. Testing for Legionella can provide critical information to ensure a water management plan is operating as intended and Legionella is well controlled. Okay, again, remember, we have Legionella in our system. It happens, right? When we come in as IWC as a provider, we come in and we test, we may detect Legionella in the system, but if it has not reached a threshold point, then we consider it controlled and it is not unsafe to anybody in that building. Okay. How do we do that? We have a lab. We come and we test. We send it off to an independent lab, not our lab, an independent lab. We get those results back. We report back to the facility. But when it creates a threshold, when it goes over a threshold, and you have a percentage of your building that is over that threshold, right? Then we're going to come in as consultants. We're going to come in and work with your leadership on what to do to ensure the safety. Either it's filtering, flushing, everything I've talked about. Because of the vulnerable population served, inpatient healthcare facilities should conduct routine testing for Legionella to validate their water management plans. This is directly from the CDC's website. Okay, which you're not going to have a greater authority when it comes to safety than the CDC when it comes to patient care and safety. Next slide. All right. I've touched a little on this, so this is my my pitch, my marketing pitch. So IWC, we are an end-to-end water treatment company. And what I mean by that is that we serve non-potable, potable, and potable water systems. Everything from our water safety division, which is what I've spent the most time describing here. This is the group that does the Legionella testing. We test for all waterborne pathogens. We remediate buildings. We consult with your facilities. We provide directive action. We interface with the Department of Health when there's questions or concerns. Our other book of business is water treatment. Water treatment, again, is cooling towers, boilers, closed loops, and our chemical use. We have sales there. And then our newest division is our high purity system, which really is applicable within the healthcare systems to ensure really the highest quality and safety of water for medical instruments or for water inside a hospital system. So you can see here for information about any of these services, you'll see our info at iwcinnovations.com, and then there's a phone number, and I guarantee you Rachel will reach out to you quickly. All right, next slide. All right. In summary, okay, mitigating the risk of Legionella in a building. I'm going to read this just because I really like it. Mitigating the risk of Legionella in building water systems is critical to protecting public health, preventing outbreaks of serious illness like Legionnaires' disease, and ensuring regulatory compliance. Proactive management reduces liability, minimizes costly disruptions, and helps maintain safe, reliable building operations. Okay, there's not a more true statement than that. Here's my kind of poking at you and what you need to remember. If it's hot, keep the hot water hot, keep the cold water cold. Remember, I gave you those parameters where Legionella colonizes, what's the best environment for to colonize. So if your water temperature is sitting at those parameter areas and not moving, the probability is that you're going to have some colonization going on. So keep your water moving. Keep the water migrating through the building. Do not let stagnation happen. If you got unoccupied buildings or rooms or whatever happens is, go in, turn the water on, and let it run. Just let the shower run, let the sink run, flush a toilet, whatever. Keep the water moving in those rooms and in that unoccupied spaces in your building. Okay. Managing water is removing the dead legs. Okay. Remove your dead legs. I put in here, monitor your pH and temperature. Obviously, we talked about temperature enough, and your oxidant residuals, which is your chlorine in the water. Why is pH important? Why should we measure it? Why? Because chlorine is effective when pH is at a certain level. 7.2 to 7.2, 7.8 is it's the most effective. Under that, over that, chlorine is not effective. It doesn't work. So the water has to be at the right pH. It's got to be in order for your free chlorine to be able to go in and attack the bugs in the system. Okay. And Legionella culture test for validation. Do not stick your head in the sand, right? Be courageous enough to know the truth. Do what you need to do, okay, to ensure that you have done everything within good measure to protect that building. Again, remember, as leaders, as people who work in our industry, our number one responsibility is the care of those people that are in our buildings, including our staff and visitors. The number two, although equally important, is risk mitigation, is reducing the risk of bad outcome probability, which going back to the slide, the expected and unexpected costs. Those are the realities, guys. That's what's going to happen, right? You're going to have medical costs. You're going to have employees out. I didn't even cover that. You're going to have employees out because they're sick, because they have pneumonia, right? You're going to have employees out. You're going to have potential lawsuits. You're going to have reputation damage. It's a downstream trickle effect that doesn't stop because, right, we're a good place and this was just a bad moment. That doesn't happen. Okay, so do whatever you can do, right, to reduce your risk and eliminate the probability of those happening. Okay, next time. All right. I'm sorry I've only left us 8 minutes. I apologize. So let's see if I can get to some questions. Anybody got any questions for me right quick? I know I've covered a lot and I apologize for talking fast, but it's the theme to Jeopardy.
Okay, let's see. How should facilities that have joint SNF, RCFE address water management plans and environmental testing.
So I would definitely point you right back to ASHRAE 188 and the CDC. Okay. They will first, guide you through your opportunity of building a water management plan if you haven't done it already. Testing is really so there's an opportunity to when you start looking at you're mapping your building and you're looking at all of your outlets and opportunities, there's an opportunity to identify kind of the locations you're going to test. I would definitely encourage you to test at different intervals and even the most distal point to ensure that you're testing the probabilities of the water moving through the system. And so as you're looking at residential facilities, the frequency of testing really, there's two things I would look at. I would look at what are your outcomes from your original test, what do those look like? If you have a proliferation of Legionella detection that's over the 1.0 CFU threshold, then I would definitely say we need to move into more corrective actions, which include, again, filtering, testing, and more frequent testing from there. Different states will mandate testing. So definitely lean into your state law if you're in a state that has one of those already identified. But that's where I would start.
We've got a couple questions here kind of asking, what is the best routine time to test and where is the best locations to test in facilities?
Sure. Best to test is year round. That's the best time to test. Monthly testing obviously is great because that means you're really allowing yourself the full visibility. Quarterly testing, and as a result, I want to say again, as a result of the testing, you will begin to identify your risk. Okay, if from that testing you have a high percentage of positive outcomes, and that's what will come back from the lab, then you know where your risk is, and you know, okay, now we need to engage different interventions. Again, as I said, there's flushing, there's filtering. If those levels are extremely high, then I would definitely say reach out to a provider like IWC and talk about remediation of the building. And then we will come back with a water management plan, with our filtering, with our flushing programs, everything you need for that.
Do you have any recommendations for those having construction happening on site?
Yeah, construction happening on site is again flushing, flushing, flushing. Okay, so construction, what you end up doing is you're shutting down water systems because you're adding rooms, you're adding wings, you're repairing things. So every time, and it doesn't even have to be inside your building. I mean, if you've got construction in your building, but every time that water slams back on, you have to remember all of that stuff that's sitting in the biofilm, all that stuff that's sitting in the system and in the sediment starts flushing through your building because that's the pressure behind it, right? So as soon as that water starts kicking back on, open up those valves, start flushing the whole building again. Let it run, let it run, let it run. If there's construction going outside of your building, if you've got construction going on down the street, which you should be notified about, um, be in contact with that contractor. Ask them when they're shutting the water. I mean, when they're shutting the water back on, so that you can make sure that those valves are open and you're flushing through that system, your system.
We've got a couple questions asking just more about state regulations, one specifically for Illinois and another for New Jersey. They're
Mhm.
just wondering where they can find what those regulations are saying and
100%.
where they're posted.
Yeah, I'll tell you what we'll do. We're going to post on here or as a follow-up, we will give y'all all of the state kind of connection, the points that has the specific law or bill that was passed and time and the date it was passed, but also what the regulatory requirements are. Because again, there's a proliferation of information that I gave just a really quick snapshot overview, but we'll do that, and hopefully that will direct those of y'all in those specific states identified on my map. You'll be able to see those links.
Perfect. If you have consecutive tests for 3+ years of negative results, would recommend continue to focus on control water chemistry parameters and maybe just sampling annually.
Yes, yes, semi-annually or annually, absolutely. 3 years, you've got a healthy system walking through. You're definitely managing your water. Again, if you're up for a survey and a surveyor comes in and sees that you've had 3+ years of non-detect, and that you've moved from whatever your frequency is to semi-annual or annual, I would probably say semi-annual just because, they're going to be completely fine with that.
Is there any good resource to use to review your water management plan and make sure that it's in compliance?
Say that one more time. I'm sorry.
Is there any good resources to use to review your water management plan and make sure that it's in compliance?
Oh, IWC Innovations. Reach out to a consultant, right? Let the people who this is what we do, let us consult with you, right? Let us take a look at your plan. Let us give you feedback. Um, we At IWC, we create water management plans. We have an app called the Smart App that allows you kind of, on the palm of your hand to be able to monitor this. But if not us, definitely reach out to a consultant. Reach out to somebody who's in this lane and ask them for a review. Obviously, the CDC gives very directive or very clear guidelines on how to create a water management plan. But again, what I'm seeing more from my Joint Commission surveyor friends is that they're drilling farther behind. Okay, you just got a plan. Okay, I got it. You're looking at the city water. They're wanting to know, right? How often are you measuring the effectiveness or quality of that plan? And what are you doing when you're finding events that are outside the parameters? So I would definitely have a consulting group come in and take a look at the very least, have a group come in, take a look at your water management plan, let us opine on what it looks like, give you feedback. We'll be happy to do that.
And then we probably just have time for one more here. There's a couple left, and we'll make sure to address those in our follow up with everyone as well. But do you recommend a separate water management plan for the ST 108 compliance apart from the arching written water management plan?
Absolutely, absolutely. So you're talking about there's so obviously with ST108 and high purity, we have there's very specific parameters, very specific testings that's outside of what we're doing around Legionella. Okay, it is water at its purest level. Obviously, it's really ST108 is really designed as an initiative that we're waiting for CMS to adopt and go forward in all healthcare systems. But it really is looking really targeting in on surgical instruments to ensure the highest quality of disinfection on those instruments. So yes, we have different sets of parameters and reporting guidelines. We also, again, IWC has created a compliance software and offers that service as well.
Awesome. I think that is all we have time for. There was a couple questions just regarding the slides. We'll send those out afterwards. And then we will also, somebody asked if we could add in the proposed state laws as well, and we can do that as well. So
Yeah.
um
So state laws are difficult to add until they become law. Okay. And the reason I say that is because once laws are in authored, they will go through a series of committees, eventually getting to calendar getting to vote, and vote getting to the governor. Anytime during the course of that, that law can be amended. It can be changed to get it through. Not uncommon for state legislators to do that. But I can definitely give you some of the framework of what I've received from those variable states as to or various states that are in the language. I can definitely update that.
Awesome. Well, thank you everybody for your time this afternoon, and thank you, Kirk, for the presentation. Very, very helpful and informative. Like I mentioned, we'll send out a follow up with all of the slides attached and the recording as well. So if you guys have any questions outside of this, feel free to email us at info@IWC, and we'll get back to you guys.
Thank you guys. Appreciate it. Remember, it's not a matter of if, it's a matter of when.
Awesome. Thanks, everyone. Have a great Friday, rest of your day, Friday, and great weekend.
Thanks, guys.